a lot of things have changed relatively recently that I think Brother Mobile feels compelled to be more forthright and transparent about what's going on in their markets. We almost feel a duty to the home health care providers. So first and foremost, there's a new compliance mandate that's right around the corner that we want to be very aware of and help our customers from a compliance perspective. Second of all, and this has been in the healthcare domain for a long time, which is patient safety, not only clinical but also for home health care. That's also important. Third thing is, and this is relatively new, the element of team care for a particular home health care patient. Lots of different disciplines coming to visit, and the risk of handoffs or gaps among those different caregivers, one of the ways in which that can be bridged is with mobile printing. And then finally, we've heard a lot from very compassionate and very passionate home health care providers who would like to have a whole lot more of their job be actually providing care, as opposed to spending so much time with administrative activity, processing paperwork, and things of that nature. So clinician productivity is also becoming much more of an important trend. We kind of have a before and after story for compliance in general in the home healthcare market. Prior to this upcoming July, some of your more progressive or contemporary home healthcare providers used to print mobily and put it into a report that was left behind called a plan of care. After July of this year, CMS has mandated that a leave behind, essentially a patient care record, a written care record, needs to be part of the delivery of their care. This is a little bit more urgent for a home health care provider than it used to be, but it also has some benefits. The benefits are that they're providing a contemporary record of what just took place. There's a very good record of what will need to happen between now and the next visit. And they also have a very good chance, since they've improved their business processes, of getting better CMS star ratings and chances of winning more contracts and higher productivity, all of those things that would be net business benefits to the home health care provider. And the plan of care covered things like medication lists, educational materials, physical therapy instructions, various other things that were necessary for ongoing home health care to take place in the home after the clinician left. It kind of circles all the way back around that as you're employing better technology, newer technology to do those now mandated things, it can not only be a better patient experience, but also a better provider experience. A lot more dynamic than one thinks. Many different caregivers are visiting. There's lots of different treatments being provided. It's kind of like moving a hospital to your home. And current technology and medical methods are allowing for that. And the survivability and recoverability rates are proving that out as being a preferred way for care to be administered. Many times there's sort of a fog of what's going on among the family and the patient, just around the whole process of care. Once you provide the clarity of a document with medications, instructions, care, all of that things, that's just one less thing they have to worry about. And if you kind of take another step back, you're giving the patient, the family, and even the clinician a chance for all of them to do their jobs, which is either recover for the patient, provide the care as far as the family and the patient is concerned. And what we're trying to do is help that whole environment be a little bit less cluttered, but still provide contemporary information on demand where it's most needed, which is right then and there. There is a supercharged environment as far as criticality of the patient, criticality of the care that they need, and also some very emotional and difficult decisions that the family is faced with. Some of our customers have found that it's very advantageous to have the technology that they need to get the hospice and home health care admissions process accomplished very quickly in that environment is a real advantage. It allows people to make those difficult elections, do them electronically, and have them evidenced right then and there without a whole lot of extra effort. And it also allows all of the people who are providing that hospice care to be gathered around the patient to make those informed decisions, get them documented in the technology that's in front of them, and then be able to move on forward with the care, which is the most important part. Home health care has evolved to an area such that there's many different specialties that are visiting a home to provide that care. So everyone from a nutritionist to a classical RN to a respiratory therapist to a physical therapist, all of them could have a role in what needs to be an integrative approach to providing a pathway to someone's recovery. As you might expect, some of those folks may come from the same agency. Some may come from other agencies or even in a subcontracting role. So there is a need to kind of keep everyone on the same page. There needs to be a coordinated plan with which all those folks don't step on each other, understand where the gaps and overlaps are, and it's updated. So mobile printing has a very strong place in teen care, which is what this is called, to make sure that the next person who comes to visit knows what took place from the other members of the team, and they're kind of accountable to each other. And one way to sort of reinforce that accountability is the plan of care that's been updated on a pretty regular basis and then left behind at the premise where all the care is taking place. And that plan of care basically can readily document who's been there, what they've done, what the next step is, and what the handoff may be to another team member, all of which is pretty critical to making sure that there's no gaps or overlaps among all those different team members and gets that patient back on the road to recovery. You know, for those folks who have adopted mobile printing as part of their normal workflow, this has probably been one of the most profound business impacts on a home health care provider. It's actually like giving back to the home health care provider 1 or 2 extra calls a day. And that's the equivalent of how much time prior to their implementation of mobile printing that they've been spending on manually writing up paperwork, going back to the office and printing forms, going to the post office and mailing it, and the drive time that's precious to them in terms of moving from one call to the next. And they would have and really enjoy the opportunity to avoid having to go back to the office and have 2 or 3 hours, perhaps, at the end of their day to do admin work. So what has changed for a lot of I would say the earlier to mid adopter home health care providers is that they've got all of their work and all of their activity on either a tablet or a PC, and all of their critical output, they're registering within the system and printing out on the spot, whether it's a medication list, a plan of care, and all of those things that they don't have to go back to the office and remember what they forgot, print out what they might have overlooked, put it in the mail, and then send it. And of course, by the time it arrives at the patient's home, it's out of date anyway. So all of those things kind of brought together also brings back an element of job satisfaction to the clinician. They don't like the idea of being clerks. They like the idea of being nurses or respiratory therapists or physical therapists, doing what they like to do with patients. And of course, their business owners like the idea of being able to fit in more calls, more visits per day as a means by which to enhance their business value too. A few things that really stand out. Number one, you need to be able to fit into their toolkit. So a typical clinician who's visiting a home health care patient has a lot of gear that they're bringing with them. It's not just the old days of a stethoscope and a blood pressure measuring machine. It's a lot of electronics, and sometimes they're dragging a lot of things with them. Where your mobile printer really needs to fit in is being small and compact and reliable, but useful for the purpose. So that's kind of the first thing that kind of is one of the major criteria, is that it's got to fit in my toolkit. And a PocketJet definitely does do that. Second thing is that they make no bones about it. They're just as rough on their equipment as a lot of other people who are in field service types of jobs. So reliability and ease of use are very important to them. And I think finally, a lot of times they don't have a hand in this choice, but depending on the PC or the tablet or even the phone that's issued to them, the printer needs to connect to that and work with it right out of the box. Those big three things, does it fit in the toolkit, is it reliable, and does it connect and work without a whole lot of extra work? Those are the big things that we're hearing from the earlier adopters of the technology, and have really gotten some substantial benefits from it.